Good afternoon, everyone. Hi, I'm Dr. Swagatesh Bastia. I'm the co-founder of Alleviate Pain Management. A very warm greeting from my side to the fraternity of interventional pain management and regenerative medicine. I will be touching upon a very interesting topic today, that is being a pain physician in India. Now, coming from an orthopedics background, it helped me understand the great value interventional pain management and regenerative medicine can bring about in the treatment of a myriad of musculoskeletal conditions causing chronic pain. Primarily due to the lack of awareness and the nascency of the field, especially in the Indian subcontinent, being a pain physician is fraught with certain challenges. But from my personal experience, I can tell you that these challenges can be overcome by the extreme joy you derive by uplifting the quality of life of people suffering with chronic pain. I would like to highlight some of the important attributes that makes a successful pain physician, or a successful pain physician should possess in our country. So let's get started with that. And first thing that I want to focus on is a desire, a very strong desire to do something different with your life. So, a common trait seen among successful people, including pain physicians, is refusing to conform to what life throws at you. Especially if you want to do something out of the norm, such as pursuing a career in pain management, be honest to your desire, ambition, and thirst for success. Most great things start with discontent, dissatisfaction, and sometimes feeling out of place. You're not alone if you feel this way. Many of the top pain specialists have been meticulous anesthetists in the first half of their journey, but the explorer within was unquenched. The yearning desire to break the mold and get into the exciting world of interventional pain management and regenerative medicine took over. Now, you can very well imagine that this transition from a set career into an absolutely new field would not have been very easy even for them, but was only possible because these individuals paid heed to their inner desires. Remember, people who desire to do something different are the ones who end up changing the world for the better. Once you have a strong desire to do something different, you need ample courage to back up the desire. Now, I would like to focus on this image a bit. Now, if you focus on this, see this image, there is a guy with both his feet in two different boats, and he's not going anywhere. You can see the yellow boards here which say God and World. For the convenience, if you just imagine this one side to be pain, the other side to be anesthesia. This picture depicts a person who has the desire to get into pain management, but has not mustered up the courage yet to get out of anesthesia completely. So, desire alone is not enough. It has to be backed up by the courage to move on. A lot of courage is actually needed to break away from the norm and follow a unique path such as pain management. But once you decide, once you muster up the courage, you have to take the plunge. There can be no half measures if you want to be extremely successful. You have to have a lot of courage because you're also facing the unknown in pain management. It being a constantly evolving field and things changing so rapidly, you need to have a very strong will on that. Showing this courage earlier the better. It's not going to be easy. There's going to be a lot of negativity when you get into a field like pain management. From sides, people say, why are you leaving your cushy job of anesthesia behind? There'll be a lot of naysayers. So you have to, with your courage, put all of them aside. Then we move on to the next topic, which is very dear to my heart and I feel is very, very important, is empathy and connect. So as you can see in this slide, empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. At the very core of your heart, you have to genuinely want to help people, wish for them to get better, listen to the patient's problems. When you're a young doctor, just come into practice, you want to express to the patient more. You want to showcase your knowledge in front of the patient, naturally to create a good first impression on the patient. But soon with clinical experience, you realize the more the patient talks, the better it is. The more brownie points you win. Don't limit yourself to time. Even if you are seeing 12 to 14 quality consultations in a day, it is much better than seeing 20 to 25 to 30 quick and lousy ones. Patient has to feel the connect. And to establish this connect, clinical examination forms a very, very important role. Every patient that you see in your pain clinic has to be touched by you, has to be clinically examined thoroughly by you. This will go a long way, trust me. Universally, every patient, when they're thoroughly examined, they feel satisfied. Now, in India, especially coming to the Indian subcontinent, India is a very diverse country with a lot of economic disparity. So you have to make sure that, you're very clean at your heart and there is no discrimination in your level of care, based on socio-economic differences. In the subcontinent, you also have to realize that we are an emotional lot. So if you are respectful, you show your care and concern for the patient, a kind and compassionate doctor in India lingers on into the patient's memory for a long time. Finally, I would like to say, remember the patient wants to be heard and not hurried. Now, it is very important to develop the mindset of a winner. Before I come to that, I would just like to bring out some of the differences between a boss and a leader. Now, this distinction is very, very critical in life because you are following a unique journey and you want to become a leader in that field. But there is a strong, strong distinction between a boss and a leader, which I want to clarify, right? So a boss demands, relies on authority, issues ultimatums, says I, uses people, takes credit, places the blame, says go, my way is the only way. Whereas a true leader will be very different, will be the completely polar opposite. He won't demand, he would coach. He would rely on goodwill, generates enthusiasm in his crew, says we, develops people, gives credit, isn't shy of accepting blame, says let's go, strength in unity. So you can very well see that, you can very well see the clear differences between a boss and leader. So my request to all of you is follow the path of a leader. Then you need to be a strong-minded person to go through the daily vagaries of the life of a pain physician. Punctuality is the politeness of kings. This is a very, very crucial thing in clinical practice, be it pain management or any other field in medicine. When you come on time, when you're timely, you're respected by your subordinates. Your subordinates also start following that. They come on time and it is a chain reaction. It is very essential that you dress well and you speak well. Something that is stuck with me, something told by one of my seniors, if you want to make $1 million, you got to look $1 million. So be smartly dressed every day to work and it will make a difference. Now, I want to highlight some of the differences in pain management between a winning attitude and a not so winning attitude. So the winners, they would be generally on time, kind to subordinates, don't make excuses, are patient listeners to their patients and their subordinates. They just don't blame others for, their faults. Now, on the other side, you see a mindset which is not tuned for success or not a winning mindset. You see these people are late everywhere, be it work, meetings, personal engagements, and they receive the same from the others as well. These are the people who you see are keep yelling at staff or the subordinates and generally are complaining about everything and everyone around them. These are actually insecure people and they are trying to hide their insecurities by these activities. Now, being in the life of a pain physician, I would like to give you an example. Say, take take a normal week in the life of a pain physician. Sometimes you have good weeks, sometimes you have bad weeks. Imagine you're having a bad week. You've not done much. You have not seen many patients. You've not had many interventions go your way. What does a winner think on a Thursday? A winner thinks on a Thursday that, how can I make my week better? How can I do some interventions that I can go into the weekend with some peace? How can I better these 2-3 days so that my weekend is peaceful? He's constantly irritated with this, and for them it won't matter if the case is at morning 6, night 10, whenever they will be up for it. So this attitude will actually, draw patients towards you and, put you on the path of success. Whereas you see the other side also, when people do not have a winning mindset, the thought process is something like this. Who will get up so early at 6 o'clock to see a case? No, I cannot travel so much to, see just one case. Work-life balance is the most important to me. I want my 9 to 5 work-life balance. And on Thursday, even though the week has not been kind to him, he already packed up the week and thinking about what to do on the weekend. So this kind of mentality definitely is not tuned for success. Now you might be wondering about, what is he talking about? I want to do pain because of the work-life balance. Yes, you will eventually get there if you're ready to grind it out for the first few years and grow your practice significantly. I would like to share some examples with you of some great people who I have personally met and interacted in our medical field. First, I'll talk about Dr. Anand Joshi, who is he is known as a king of arthroscopy in India. In the beginning, when arthroscopy was a relatively unknown entity in India, he used to travel all across Maharashtra, and he's done his first 100 cases for almost free in villages, in remote villages, remote towns. He used to he used to travel with his kit, and wherever, he got an opportunity, he would operate. This is how he developed a presence in arthroscopy and started off. So a 9 to 5 attitude, you think if he had, would he been able to do that? Not at all. He would wake up at 4 in the morning to travel to distant places, come back at 12. Sometimes, he's told me himself, he barely got to spend time with his family in the beginning years. Then another fine personality that I came across, Dr. Ramakant Panda, who is the founder of Asian Heart. I went to meet him after my MBBS, before my residency, just to get some inspiration from him. And Ramakant Panda, let me tell you, he's operated on Dr. Manmohan Singh and is one of the finest cardiothoracic surgeons in the country. The only thing that he said is, son, I don't have much time, but if you're ready to put in 15 to 17 hours of work for 15 years, you might get where I am. That was a very strong statement, but that clearly shows, the will and determination of these great and successful people and what they have given. When we see them, we like to see the success. We like to see what it is after being successful. We like to see, the nice clothes, the nice cars, the nice lifestyle. But what we don't see is the 15 to 20 years of immense struggle one needs to put in to get there. Next is an incessant inquisitiveness to learn every day. Without an inquisitiveness to learn every day in pain management, you'll be left out. This is because there are new things, new techniques, new ideas coming every now and then in pain management. Another beautiful thing about pain management that I have seen is you have to have a combined knowledge about many fields. You need to be well informed about orthopedics. You need to have a strong understanding about spine surgery, neurosurgery, radiology, anatomy, and physical therapy. So that we can see there's a lot of work to be done. To me, an ideal interventional pain physician is the perfect blend between a surgeon and a physician. So as the great Albert Einstein said, once you stop learning, you start dying. So for us, it holds even more true in the medical profession, where We got to learn every day. The learning cannot stop. Next, I want to basically, you need to have this feeling within you, this responsibility towards your field of interventional pain management and regenerative medicine. You should want to become the flag bearer. Spread the awareness in the medical fraternity. So lack of awareness is a pretty lack of awareness in what we do about what we do in pain management is a big obstacle that pain physicians in this country have to overcome. So you have to do your bit in spreading the awareness, not only in the medical fraternity, also spread awareness in the public, in social media. Sometimes, what you do outside work hours actually makes the difference to where you get in life. Then don't be shy of giving talks at apartment complexes, corporates, schools, wherever you can let people know what you're doing and inform them, of this beautiful specialty. This is how you're going to build your base. And then I would like to say, and you definitely have to also spread it in the medical community. You need to develop your own network of doctors who would probably refer cases to you. Then, very important is you become a people's doctor. When you're seeing people in pain and you're treating them, which is a a person in pain, agony, and suffering is coming to you. And when you help them out, you connect with them in a very, I would say, very integral manner. So become a people's doctor. Be fearless. Now, I like this saying by Taylor Swift quite a bit. To me, fearless is not the absence of fear. It's not being completely unafraid. To me, fearless is having fears. Fearless is having doubts, lots of them. To me, fearless is living in spite of those things that scare you to death. Now, being fearless in pain management is very important because, like I said, it's a new niche field where developments are happening at a rapid pace. So you need to be fearless in trying new techniques, and you always have to be trying to push the boundaries as to keep pace with the constant evolution that pain management is undergoing. Now, you have to start inculcating new treatment modalities. You cannot say that you are only a fluoroscopy guy or you only an ultrasound guy. Now, you need to keep an open mind towards different techniques, different modalities. I would like to give an example of a couple of such instances or a couple of such treatment modalities which we inculcated into our practice. I mean, we were not sure what would be the result, but we were, I would say, fearless in some way, in getting them into our practice, and it really paid off. And it is one is I want to talk about the remarkable success we had with prolotherapy. A couple of years back, we came across prolotherapy. We spoke to some of the famous prolotherapists in the world, and we thought of inculcating prolotherapy in our regenerative practice in a big way. So we've seen some remarkable results ever since in treating patients with lax knees, cervical instability, tendinopathies, and runner's knee and iliotibial band syndrome. Then there is some procedures, some of the techniques of the yesteryears were more based on fluoroscopy. But I can proudly say that the pain physicians at Alleviate are, abreast with the modern advancements to the T. And for a lot of knee and spine procedures, they have started using this hybrid imaging using the C-arm and ultrasound to much better effect. This increases their accuracy many-fold. Next, we move on to a very vital cog in the practice of pain management, that is patient counseling. Now, understanding the patient's functional requirements is of prime importance. So, example, if you're treating knee pain and you're treating a 30-year-old with knee pain compared to a 70-year-old with knee pain, there has to be a difference, there is a difference in functional requirement between the two age groups. So what is very important is that you set expectations of the patient. If you don't set expectations right, it can really come to haunt you, later, when the results don't go your way. But if you set the expectations right with the patient, you understand the functional requirement of the patient, you clearly explain to the patient what you think will be the benefit of them undergoing a procedure, they're in a much better place. Then another very important thing in the counseling of pain management is you constantly drill it into the patient's head the importance of their active participation in their treatment, emphasizing on nutrition, healthy lifestyle, and a rigorous structured physical therapy regime to help them get back to where they want to. I would like to also bring about, this is something from my own personal experience over the last 4 years. I have realized is a pain physician should follow the middle path of Buddha. I say, don't get too ecstatic with the good things, with the happy things. Even if you are, don't show it on the outside. At the same time, don't get too disappointed when things don't go your way, because it's a long journey. There are going to be vagaries in your practice, but try to maintain a calm demeanor, not get too happy, not get too taken aback. Pain management as such can be very humbling at times. Now, I'll give you an example which highlights this point about patient counseling. Something which is very common in pain practice are lumbar transforaminal injections. Now, sometimes lumbar transforaminal injections can be magical and absolutely get someone better, and patient is all right for sometimes 2 to 3 years. Patient is happy, you are doubly happy, and that patient brings you even more patients. But sometimes you do the same technique with the same perfection, a transforaminal injection for someone, and the pain comes back in 2 weeks' time. Now, if you've not counseled this patient well, he's not going to be a happy chappy coming back to you in 2 weeks' time. So that's why if you counsel them properly, saying, there is a good chance that you might get much better, but there is also a chance, depending upon the pathology in itself, that the injection might not suffice, and the patient might need to get operated. Next, I will talk about the ups and downs in the life of a pain physician. The daily rigors in the life of a pain physician can be quite demanding. Like any field, there is a significant learning curve. A doctor who has not faced complications has simply not treated enough patients. In the beginning, you are thinking, stressing about these, taking them to sleep, which is affecting your mood. Sorry, it can't be helped. Only more experience, more patience, and more procedures will make you confident of addressing complications. No books or talks can teach you this. Only going through the daily rigors of a pain physician's life will teach you this. So this was the downs. Coming to the ups, the joy of a patient feeling better with your treatment, the joy you get when your patient brings along their relative vocally vouching for you, the joy you get when a patient has traveled 500 miles just to get treated by you, it is priceless. You have to understand the limitations yourself. No one can give 100% results, be it surgery or pain management. Don't be too hard on yourself. If you are true to yourself, you've given your best shot, I don't think you have anything else to worry about. Also, another very, very important thing is you draw positivity from all the patients who have fared better. This will help you tide through the tough times. Finally, highlighting the scope of pain management. The only one word that highlights the scope of pain management as per me is limitless. As you can see in this slide, you are your only limit. When it comes to pain management, I think I get excited. I get very excited talking about it, because right now it's when you enter into pain management, it's like a blank canvas with limitless opportunities for you. And I say that because in pain management, you literally get to treat the whole human body. you get to treat so many different types of pains. You get to treat so many body systems. You get to try so many different techniques. You treat musculoskeletal pains. You treat cancer pains. You treat myofascial pain, so many pains. It's never ending. The list. So the learning, there is so much to learn, and there is so many exciting things to do. As you see, as we can gather from the West, the stem cells, spinal cord stimulators, endoscopic spine, these things are coming into big way into the field of pain management. There is a big runway. It's an evolving science, and exciting changes will come along. But I think all those who are in pain management, or who have decided to take up pain management as a journey, they are in for a fun ride, and the future looks very, very bright. Another thing I want to highlight is one's own experience with patients ranks above everything else. You might attend a number of conferences, you might do fellowships, but ultimately the real learning happens when you start treating patients. You see how they respond to your treatment, and that's how you grow. I would like to end with a final recipe, which I think would, in a crux, showcase what it needs to be a successful pain physician, as per my books. So, be hungry, always, be obsessive, and be passionate. And mix all these three with a tinge of madness. I think you will get there. Thank you so much for your time today.